This is Dr. Stephen Harkins, and page 79 of the Anatomy Coloring Book. We have talked previously about the ascending tracts from the sensory nervous system, the information that goes upward toward the brain, sensory information from afferent neurons. Now we're going to talk about descending tracts from efferent and the efferent system. The motor system. In other words, the system of neurons that go from your brain down to your body to your muscles, tell them to move. So, as is stated here, the principal neural pathway is the corticospinal tract. The corticospinal tract. Now you can tell by the word corticospinal that the impulses are going to go from the what? From the cortex down to the spine. And the opposite direction of what we learned previously. Obviously, it's got to go downward because the signals are coming from the brain to the body, to the muscles. So they begin in the motor cortex. The motor cortex. Now, in the last lesson, when we talked about sensory, we talked about the information arriving at the post-central gyrus. That's this area here. But that's the sensory cortex. We're talking about motor now. And the motor cortex is here at the pre-central gyrus. And that's what's shown here. The pre-central gyrus, the motor cortex of the cerebrum. So signals would be coming from the pre-central gyrus of the motor cortex and heading down, passing through the brainstem, down through the spinal cord, out to the body to tell your muscles to contract, to do things like skilled muscular activities like writing, or basic movements like walking, running, etc. Again, the precentral gyrus is the motor cortex. This is where the corticospinal tract originates or begins. Now, these tracts have a name, a funny name called pyramidal. The pyramidal tract, coming from the word pyramid. And it's named that way because as these tracts pass down through the brainstem, they pass through the medulla oblongata. And an area on the front of the medulla oblongata, these two stacks right here, well, they're called pyramids. They don't look like pyramids to me, but we're calling these stacks pyramids. And I suppose if you look at them from the top, they would look like this, which I guess you could say is like pyramid shaped right here. So that's why they're called the pyramidal tracts. So as these neurons travel downward, they travel through the medullary pyramids. So we're going to call it the pyramidal tract. So let's follow the path along the corticospinal tract, or aka the pyramidal tract. So here's the cell body of a neuron, a motor neuron, I guess you could say. And it heads downward through the what? The corona radiata. And passes by the thalamus, not passing through the thalamus, down through the pons, the brainstem, the pons, and the medulla oblongata. And we learned what these areas of the medulla oblongata are called. The what? The pyramids of the oblongata, the medulla, and downward through the spinal cord and passing and then synapsing where? Not in the posterior horn, but this is the motor system we're talking about. The sensory information happens in the posterior horn. So this neuron, this first order neuron, you could say, is traveling to the anterior horn, the motor area of the spinal cord. So if this is a cross section of the spinal cord, you got your dorsal horn back here, right? And then this anterior horn up front. So the motor and the corticospinal tracts, these neurons, they synapse in the anterior horn of the spinal cord. And you can see that occurring here. Well, where does the second neuron go? Out to the muscles. And it tells your muscle to contract. So this is what's happening here when you try to write. Signals in the cerebral cortex and the precentral gyrus are being generated here, up here. And that excitement and that sends an electrical signal down a neuron, the axons of the neuron. And in the pyramids of the medulla oblongata, crosses over 80% of the time, there is a crossover into the anterior horn of the spinal cord and then out to your muscles to say contract. In other words, come together, squeeze. In 20% of the cases, excitement, a neuron will be excited in the cerebral cortex in the precentral gyrus, the motor cortex of your brain. When you want to move, when you want to write something or do some sort of activity, motor activity, muscle activity, the signal will come down through the corona radiata, right? Radiata. And pass downward. And in this case, not cross over and go straight down. Remember that word for crossover is decussate. And 20% of the time, there is no decussation. The signal will travel down to the posterior horn? No, that's the sensory horn. To the anterior horn of the spinal cord. And a synapse will occur, and the signal will go out to a muscle on this side, telling that muscle to contract. Earlier, I had stated that these are motor neurons. Probably not the most accurate way to say it. The motor neuron is this second order neuron here that goes out the muscle. To be more accurate, that's really considered a motor neuron. And it's called a lower motor neuron. Actually, this is considered a neuron. This is called an upper motor neuron. And after the synapse in the anterior horn, here's your upper motor neuron in the spinal cord, synapsing with a lower motor neuron in the skeletal muscle. So upper motor neurons in the brain and spinal cord, and then this is your lower motor neuron right here. And the effector is the muscle. It's the thing that the lower motor neuron is affecting. So to review some terms here, we have the motor cortex out here, the pyramidal tract, this corticospinal tract, called pyramidal tract because it passes through these pyramids here, these medullary pyramids. And the corticospinal tract is divided up into lateral, anterior, of course, the medullary pyramid area. It's the places where the corticospinal tract travels through. We're getting into a lot of detail with some of these terms, but most important to know the motor cortex, the pyramidal tract, and the corticospinal tract. Because these neurons that we just discussed travel through these medullary pyramids, we call it the pyramidal system or the pyramidal tracts, right? But some motor neurons do not travel through these pyramids. They just travel straight down through the medulla oblongata, through the pons, through the brainstem and the spinal cord to the effector organs. And that's called the extrapyramidal system. And it is a vast system with lots of little, what are called interneurons, little in-between neurons, you can see here. And the important thing to know about the extrapyramidal system is that it's really a system that modifies, and if you look over here, it's a system that modifies the signals. So I'll show you in 1 second. The signals that come down from the cortex in the pyramidal system are very gross, very excitable system, and it simply says move, muscle, contract. It's a very blunt system. Contract. You know, it might be a loud signal, okay? Move, contract, okay? Well, the extrapyramidal system modifies this system right here and says, wait a minute, well, not so fast. So it's a system from different parts of the brain that modifies and facilitates and inhibits this very gross signal. And it sort of limits your movement so you don't walk around clunky. It smooths out the system. So if you read here on the right, discharge of the lower motor neuron is dependent on the sum of the facilitator or helpful or inhibitory impulses impinging on it at any moment. That's where this extrapyramidal system comes in. So when you decide to move up here, the impulse to do that comes from the cerebral cortex. But there are other parts of the spine, or excuse me, the brain and nervous system that want to sort of get in on the action and smooth that movement out. So other areas of the brain might want to get on the action. Other areas of the cerebral cortex, like right here, maybe it wants to get in on the action and smooth that movement out. And or input from the basal nuclei, which we discussed in previous lessons, from the cerebellum, right here in the cerebellum. This guy wants to get in and have a say in the movement as well. And so the signals from all these other places do not pass through the medullary pyramids. So hence the name extrapyramidal system. So these signals come from the reticular formation, the reticular nuclei in the brain. traveling on the reticulospinal tract, makes sense, and the vestibulospinal tract from the vestibular nuclei in the brainstem. All these different areas, other areas that we're not going to learn about, the rubrospinal, the tectospinal tracts, all these other areas of the brain want to get in on the action and try to modify this gross movement to make your movements more coordinated. So when these signals come from other areas of the brain, they'll travel down these tracts here. The rubrospinal tract, the vestibulospinal tract, the tectospinal tract, the reticulospinal tract, and they will synapse. They'll come down these tracts here, and they will synapse in the anterior horn here with interneurons right here, right? And down these tracts, and they will modify that very strong signal that came from up here from the cerebral cortex. And they will either facilitate, maybe they'll even make the signal stronger, but maybe they'll inhibit the signal. They'll facilitate or inhibit and modify and smooth out the signal. And here's this lower motor neuron going to tell the muscle to, again, contract. The initial signal might say strong, and this signal might be, well, let's think about that. Let's make a signal a little bit weaker so we contract a little less. So all these different areas, so motor movement is very complex, as you can see, and it's a combination of lots of different signals from different areas of the brain. The pyramidal system and the extrapyramidal system. That completes this lesson on the descending tracts of the central nervous system, page 79 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Until the next lesson.